Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong, which is found on HealthLinks. Aging Strong is sponsored by the Quincy Health Department. Today, I have a special guest speaker. She is the epidemiologist that works in the Quincy Health Department. Sandy?
Hello, everyone. My name is Sopet Sandy So. As Debbie has said, I am the epidemiologist for the Quincy Health Department.
Great. Thank you so much for being here. I'm very excited to learn about the topic cardiovascular health. Being a nurse for many years, I used to work for a few years on the cardiology floor. And boy, there's a lot of education and a lot of awareness that's so important for the people out in the community to help hopefully prevent or help take care of their current cardiovascular condition. So as you're putting on your slide presentation, can you just tell us how you got into epidemiology and what is that anyways?
Oh, yes. So my role as epidemiologist and epidemiology in general is the surveillance and monitoring of disease states in the community. So for example, my day-to-day tasks are to look over any communicable diseases that might pop up in Quincy specifically, as well as follow up and interview cases that are positive for any communicable disease. My main focus is COVID-19, especially because since the pandemic, there was a big local health need for epidemiologists at the local level, because we do have a big team at the state, but for local resources, there wasn't as big of an epidemiology team at the local level. So because of COVID and how the pandemic created a lack of resources, seeing the lack of resources in that aspect, they decided to have epidemiologists at the local level. But overall, I got into public health in general because my background in my bachelor's is I used to work as a medical laboratory scientist. So I would be the one who was running the tests, like mainly during COVID. During the height of the pandemic, I was actually working in the hematology lab and running a lot of the testing that was done for COVID, as well as for the patients that were in the hospital. So we did a lot of swabs. We got a lot of blood samples during that time. And because of that, I was also going to school for public health because personally, my mom had a lot of conditions going on. So because of that, I was really big into understanding how the healthcare field, as well as understanding public health in general and how prevention is a big factor to your overall health. So that's how I got into public health. And when I was in school for public health, I really enjoyed epidemiology because I do love understanding the pathophysiology of the different diseases, as well as how it impacts individuals as well as the community. So I would say that's how mainly I got into epidemiology.
Yeah, it's so fascinating. It's so fascinating. People, sometimes they think, okay, I'm going into the hospital because I'm sick and the doctor's going to take care of me and that's it. But if you really take a step back, if a lot of people came to see their doctor for the same condition because they live in a certain area, because they have the certain age or whatever, a pattern starts forming and you need somebody who has a background in data collection, interpreting statistics to be able to put two and two and two and two and two, two and two together in order to find a way to kind of maybe create a solution for whatever it is that brought those people in the first place. It's really fascinating. I find it really interesting. So I don't want to keep you any longer. I know you have this wonderful presentation on cardiovascular health.
Okay, so today's presentation will be on cardiovascular health. Let me go to the next slide. So what is cardiovascular health? So cardiovascular health refers to the heart, to the health of the heart, as well as the blood vessels. Your heart, as the center of your cardiovascular system, is vitally responsible for just about everything that gives your body life, ranging from the transportation of oxygen to the overall success of your immune system. A healthy heart is very central to overall good health, and leading a healthy lifestyle is key for improving and maintaining cardiovascular health. And again, you are never too old or too young to start taking care of your heart. And since we're talking about cardiovascular health, we will go into cardiovascular disease. So cardiovascular disease is a group of conditions that affect your heart and blood vessels. And usually the conditions include heart disease, which mainly is caused by arteriosclerosis, which is plaque buildup. And then we also have heart attacks, which is caused by blood flow and the heart is blocked by clot. We also have stroke. There are two main types of stroke, which include ischemic stroke, which is when a blood vessel is blocked by clot. And we have hemorrhagic stroke, which is when a blood vessel in the brain bursts. We have heart failure, which is when the heart is not pumping blood correctly. We also have arrhythmia, which is abnormal heart rhythm. And we also have heart valve problems, which is malfunction of the heart valves. So since it went to the next slide already, so here are the factors that affect your heart health. So we have diet and obesity, healthy diet, physical activity. We have medications, alcohol intake, gender and ethnicity, genes, aging itself, excessive alcohol consumption, smoking, and those are the overall ones. But I think one of the biggest ones I would like to highlight is social determinants of health, which encompass economic, social, environmental, and psychosocial factors that influence health. It plays a significant role in development of cardiovascular disease risk factors, as well as CVD morbidity and mortality. Since we're talking about social determinants of health, I would like to talk about COVID-19 and cardiovascular health. So not only does the pathophysiology of COVID-19 disease impact systematically cardiovascular outcomes directly, but social determinants of health play a critical role as well. So according to research by Russo et al., the COVID-19 pandemic exerted negative shifts in social determinants of health and cardiovascular risk factors. For example, smoking, body mass index, physical activity, dietary habits, cholesterol, blood pressure, and blood sugar. Also, for example, evidence suggests that unemployment and food insecurity have increased, whereas healthcare access and income have decreased. These changes to social determinants of health have resulted in increases in loneliness and processed food consumption, as well as decreases in physical activity and hypertension management.
So as far as social determinants of health, can you just in a nutshell kind of explain what that is so that I know you had a slide that explained it, but it's just had, it's just it can be very technical for some people. Slide 4, I believe.
Slide 4.
Yeah.
Yes, yes.
So
social, yeah.
Go ahead.
Okay. Yeah. So again, social determinants of health, it encompasses the economic, social environment, and psychosocial factors that influence health. So when we're talking about economics, that's usually, your job as well as your financial status, what may be going on in economics in general, even the economic state of the country you're living in or the state that you're living in as well. Social determinants of health is, again, your social relationships, your connections at work, your connections with family, things like that. So social connections in that aspect. Environmental determinants of health are your environment. So your home, your workplace, as well as the weather or the outside world in general. Or like, how many like access to food as well, depending on how far is your grocery store, how far is that fast food restaurant over there, And then psychosocial factors are most likely like your mental health state, as well as how you how you handle certain stressors in life, such as if you're going through any financial stress, family stress, medical stress itself, and how you handle that in regards to how it all comes into play with all the connections you have in your life. Hopefully that helps with understanding social determinants of health.
Yes, it does. It's just, again, it's just I used to working in the cardiology floor many years ago, there's the old mentality that it's just, eating fatty food or fast food, and eating a lot of it. Those are the factors that they think contributes to having, a bad heart. high cholesterol, high blood pressure. But with the social determinants of health, what you're sharing here is there's other factors too. Yes, the food that you're eating, if it's really fatty, if there's high calorie, fast food, but there's also other elements that contributes to how healthy you can be, right? Social, connections, your work, the economics, everything. So it's really fascinating.
Yes, I think it's overall generally everything in your life impacts your health. So I think that's the overall viewpoint of how social determinants of health impact your physical health directly.
Mm.
All right, so I wanted to talk about the cardiovascular disease statistics since the COVID-19 pandemic. So in the first year of COVID-19 pandemic, we saw a steep rise in cardiovascular disease deaths in the United States, especially high mortality rates for Asian, Black, and Hispanic people, according to the American Heart Association. Cardiovascular disease-related deaths jumped from about 875,000 in 2019 and then about 930,000 in 2020. And the largest single year increase since 2015, and this has been the largest single year increase since 2015, according to American Heart Association's update. Also, the number of deaths surpassed the previous high of 910,000 in 2003. So these numbers really have increased a lot since the pandemic.
Wow.
It's been cardiovascular disease has always been an issue, but now it's a much bigger issue.
Yeah. Yeah.
All right. So overall statistics in the United States. So cardiovascular disease itself was listed as an underlying cause of death, and it was a cause of death for about 931,000 deaths in the United States in 2021 alone. Heart disease and stroke claimed more lives in 2021 in the United States than any form of cancer or chronic lower respiratory disease combined. And in 2021, coronary heart disease was the leading cause of deaths, about 40%, attributable to coronary vascular disease in the United States, followed by stroke, about 18%, and other CVD, about 17%, and high blood pressure, 13%, heart failure, 9%, and diseases of the arteries, about 3%. So again, you can see the statistics in the United States, it's very high.
Yeah.
A lot of these risk factors are very high itself too. So let's go into cardiovascular disease by states. So you could see, so I got this information from the American Health Rankings. So for cardiovascular diseases, the values of the percentage of adults who reported ever being told by a health professional that they had angina or coronary heart disease, a heart attack or myocardial infarction, or a stroke. So the top states that had the least value were Utah, Colorado, and California. The bottom states who had the highest values and the highest rankings were Alabama, Arkansas, and West Virginia. And you could see that Massachusetts is within the top 20, ranking at 16 between the different states for cardiovascular diseases. Going into diabetes, because diabetes is a very big factor, risk factor for cardiovascular disease as well. So the values are the percentages of adults who reported ever being told by a health professional that they have diabetes, excluding prediabetes and gestational diabetes. So you can see that the top states that had the least amount of diabetes, the least value, is Colorado, Montana, Vermont, Alaska, and Utah. The bottom states who had the highest values of diabetes were Alabama, Arkansas, and West Virginia, which are very similar states to the bottom states for cardiovascular disease as well. And you can see that Massachusetts, again, is ranking in about 16 with a value of 10.5% for diabetes, which is, again, very similar ranking to what we have for cardiovascular disease. So other rankings for Massachusetts, you could see that for high blood pressure, we have a value of 29.9%, and we're ranking at 9. For high cholesterol, we have a value of about 36%, we're ranking at 25. Obesity, we have a value of about 27%, and we're ranking at 4. Exercise, we have a value of about 22%, and our rank is 28. For physical inactivity, we have a value of about 21%, ranking at 11. And fruit and vegetable consumption, we have a value of about 7% and ranking at 21. So overall, I would say Massachusetts is doing pretty well because we're not under the 30 rank, I would say. So we're still within the top 30 for these risks. All right, so this next slide is top 10 leading causes of death in Massachusetts. So you can see that cancer itself is the number 1 cause of death in Massachusetts. But the second leading cause is heart disease itself. So heart disease is still one of the major deaths in Massachusetts specifically. The rest include COVID-19. Again, COVID-19 is still very prevalent right now. And then we also have accidents, chronic lower respiratory disease. We have stroke, Alzheimer's disease, diabetes, kidney disease, and chronic liver disease and cirrhosis. So I would say it's not as surprising to see heart disease as one of our top 10 leading causes of death in Massachusetts, because overall in the United States, cardiovascular disease itself is one of the leading causes of death and usually is the number 1. And again, these death rates on this table right here are the number of age-adjusted deaths per 100,000 total population in Massachusetts specifically. So since we see how important cardiovascular health is and the biggest impact on mortality and morbidity, we need to really look into our risk factors. So there are non-modifiable risk factors as well as modifiable risk factors. Non-modifiable risk factors include race and ethnicity, genetics, gender, and age. Those are things that we can't change. But we have modifiable risk factors, including unhealthy diet, high blood pressure, high blood cholesterol, smoking, diabetes, physical inactivity, as well as obesity. And I think one of the biggest things about this is that, again, these are modifiable risk factors. These are things that you can change to decrease your cardiovascular disease risk. So how do you reduce your risk? Based off of the CDC as well as the American Heart Association, we have 2 big things that you can do. So you can choose healthy habits, and choosing healthy habits includes choosing healthy foods and drinks, keeping a healthy weight, getting regular physical activity, do not smoke, and get healthy sleep. So how do you, so again, another one is take charge of your medical conditions. So check your cholesterol, control your blood pressure, manage your sugar levels as well as diabetes, take your medicines as directed, and work with your healthcare team. Okay, so the first prevention is choose healthy foods and drinks. So be sure to eat plenty of fresh fruits and vegetables. Eating lots of processed foods or foods high in saturated fat may contribute to heart disease. Eating foods high in fiber and low in saturated fats, trans fat, and low cholesterol can help prevent high cholesterol. Limiting salt in your diet can also lower your blood pressure. Limiting sugar in your diet can also lower your blood sugar level to prevent or help control diabetes. Again, do not drink too much alcohol, which can raise your blood pressure as well as cause some long-lasting effects later on in life. So I have this picture of MyPlate on the slide because I think MyPlate is a really great resource for trying to eat healthy. It has a lot of different recipes on there that will help you, and they also look into your age as well as your physical activity level, and how many fruits servings of each food group that you should be consuming. All right, and again, diet is very important with keeping a healthy weight as well. So people with overweight or obesity have a higher risk of heart disease. Carrying extra weight can put strain on your heart and your blood vessels. Body mass index, which is BMI, is a numerical value of your weight in relation to your height, and it's a very useful gauge. So optimal BMI for most adults ranges from 18.5 to less than 25. Again, you can calculate it online or you can consult a healthcare provider. So again, tying in with weight as well as nutrition, getting regular physical activity is one of the biggest modifiable risks as well. Physical activity can help you maintain a healthy weight and lower your blood pressure, blood cholesterol, and blood sugar levels. Adults should get a weekly total of at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity or a combination of both, spread throughout the week. According to the American Heart Association, these are like some of the tips to get when you are doing physical activity. So be strong. Include muscle strengthening activity, such as resistance or weight training at least twice a week. Add intensity, increase time, distance, amount, or effort for more benefits. And sit less. Get up and move throughout the day. Kids and teens should get at least 60 minutes of physical activity every day, including play and structured activities. The biggest modifiable risk factor is do not smoke. So, cigarette smoking greatly increases your risk of heart disease. If you don't smoke, do not start. If you do smoke, quitting will lower your risk of heart disease. Use of inhaled nicotine delivery products, which includes traditional cigarettes, e-cigarettes, and vaping, is the leading cause of preventable disease in the United States, including about a third of all deaths from heart disease. And your doctor can suggest ways to help you quit, or your healthcare team. All right. So now let's get into getting healthy sleep. So most adults need 7 to 9 hours of sleep each night. Poor sleep may put you at a higher risk of cardiovascular disease, cognitive decline and dementia, depression, high blood pressure, high blood sugar, and high cholesterol, obesity. The benefits of sleep include healing and repair of cells, tissues, and blood vessels, a stronger immune system, improved mood and energy, better brain function, including alertness, decision-making, focus, learning, memory, reasoning, and problem solving, as well as a less risk of chronic disease. So one of the things that you could do with your healthcare team is check your cholesterol. So again, cholesterol is a fat-like substance that comes from two sources, which is from food and your body. It travels in the body by lipoproteins, which include LDL and HDL. So traditionally, HDL is known as the good cholesterol. It's the high-density lipoprotein. LDL is traditionally known as the bad cholesterol, which is the low-density lipoprotein. HDL, the main job of HDL is that it helps keep LDL from sticking to artery walls and reduces plaque buildup. This process can lower the risk of heart disease and stroke. Triglycerides is also one of the most common type of fat in your body. So when you are looking at your lab values for total cholesterol, the equation is HDL level plus LDL level plus 1/5 of the triglyceride level equals your total cholesterol level. And then your healthcare team should test your blood levels of cholesterol at least once every 4 to 6 years. But if you do have a family history of high cholesterol, or if you are diagnosed with high cholesterol, they will check your cholesterol more often, just to make sure that we're monitoring it as well as treating it correctly. So for the next risk factor is blood pressure. So controlling your blood pressure is a very important thing as well. So high blood pressure usually has no symptoms, and it has to be checked on a regular basis. So your healthcare team should measure your blood pressure at least once every 2 years if you have never had high blood pressure or other risk factors for heart disease. But if you do have high blood pressure or a family history of high blood pressure, then your healthcare team would check your blood pressure more often. Again, you probably already know that your blood pressure does get taken every time you do see a healthcare professional or practitioner, as well as whenever you go to urgent care or you're inpatient. So they always check your blood pressure because that is a big indicator of how your heart is functioning. So these are the blood pressure categories. You could see that normal, the upper number should be lower than 120, and the lower number should be lower than 80. You can see that for elevated blood pressure, it's between these ranges for the systolic and diastolic numbers. For high blood pressure, the systolic value is 130 to 139, or for diastolic, it's 80 to 89. For high blood pressure, hypertension stage 2, your systolic pressure is 140 or higher, for diastolic it's 90 or higher. And when you're in hypertensive crisis, your systolic pressure is higher than 180 and your diastolic is higher than 120, which is very critical.
It's very interesting that I love how you're going through the different measurements that can help people with improve their cardiovascular health, like sleep and smoking. And I think before we came on, I was asking you about the e-cigarettes. I'm seeing a lot more people using that and less people doing the cigarettes. So I don't know if it's like a fad. I'm not sure if it's promoted to be healthier than the tobacco, the traditional cigarettes. Can you speak a little bit more about that?
Yeah, I think based off what we're seeing already is that majority of tobacco products, as well as e-cigarettes, as well as any other smoking products, tend to advertise it as, for e-cigarettes specifically, as healthier than traditional cigarettes, mainly because it's usually a rechargeable like pen or versus like the paper traditional cigarettes. So because of that, they say, oh, it's less carcinogens going into your body because you're not smoking or inhaling the actual paper product. But that doesn't change the actual substances that is used in the cigarette, as well as e-cigarette, as well as for vaping. Because you're still inhaling those specific products, which are mainly carcinogens for your body, that's why it's still equally as unhealthy as it could equally be as unhealthy as smoking a traditional cigarette. Again, e-cigarettes and vaping are one of the newer forms nowadays, so there's not too much research on the long-term effects of them. And that's very similar to just the overall history of cigarettes as well, is that it took us more than 50 years to understand that cigarettes wasn't healthy for us, So I think there's going to be more research that does pop up in regards to e-cigarettes as well as vaping products and how it does directly influence your health as well as your lung condition and overall health. There's a lot of different new products too that, like for vaping and e-cigarettes, is that there's a lot of flavors. And I know Massachusetts specifically banned flavors, but because we have access to Rhode Island, we have access to New Hampshire. Rhode Island and New Hampshire do not have any of those laws and policies governing the sale of flavored products. And because they're flavored, they're much more popular among the younger population. So a lot of like the high school, as well as a lot of the college students do like to vape more than to smoke. And I think because of the big companies' advertisements on the flavors as well as the societal impact of it. Yeah.
Yeah. Yeah. It seems like the flavors would kind of make it seem more fun to try.
Yes.
or less benign, less, bad for you because it's, being flavored. Yeah, it's just a very interesting marketing ploy. That's
Oh,
a
definitely.
lot of people's help. Yeah, so please go on. It's I'm really enjoying your what do you have to share with us?
So let's go into managing your sugar levels and diabetes. Again, this is one of the biggest risk factors that is modifiable. So most of the food that we eat is turned into glucose or blood sugar that our bodies use as energy. Over time, high levels of blood sugar can damage your heart, your kidneys, your eyes, and your nerves. So since we're talking about diabetes itself, two of the biggest ones are glucose and insulin. So glucose is the carbohydrates and sugars in what you eat and drink turn into glucose, sugar, in the stomach and digestive system. Glucose that can then enter the bloodstream. Insulin is a hormone made in the pancreas that helps the body's cells take up glucose from blood and lower blood sugar levels. If you have diabetes, usually it could be genetics or from insulin not working correctly. So it's very important to monitor your blood sugar levels carefully and talk to your healthcare team about treatment options. Again, you can manage your sugar levels by specific tests. So for A1C is a big indicator on your baseline sugar level throughout time. So I know for diabetes, if your A1C is high, there's different rankings for pre-diabetes as well as diabetes itself. So definitely get your A1C checked. And then if you do have diabetes, usually they do monitor your A1C and how that's progressing, as well as you check your sugar daily with a simple glucometer, as you can see in this picture right here. So very similar to controlling your diabetes, controlling your cholesterol, controlling your blood pressure. One of the big things is take your medications and work with your healthcare team. So if you do take medicine to treat high blood pressure, high cholesterol, or diabetes, follow your healthcare team's instructions carefully. Always ask questions if you don't understand something. Because again, there's a lot of different medications out there. And if you don't understand what you're taking, definitely please do ask your healthcare team about the medication that you are on and what you should be expecting for effects. And never stop your medicine without first talking to your doctor, nurse, or pharmacist. And overall, it's very important that you work with your healthcare team to prevent and treat the medical conditions that lead to heart disease. Again, discuss your treatment plan regularly and bring a list of questions to your appointments. So these are the big takeaways that I would like for you to know from this presentation. So cardiovascular health highlights. So cardiovascular disease is the leading cause of death in the United States. COVID-19 pandemic has played a major role in the social determinants of health factors for cardiovascular disease specifically. Heart disease is the second leading cause of death in Massachusetts, with stroke and diabetes within the top 10 rankings. Overall, Massachusetts ranks well compared to other states in the US and does not exceed over rank 30 for any of the health measures by the American Health Rankings. Cardiovascular disease has many modifiable risk factors, including diet, physical activity, smoking, drinking, sleeping habits, and controlling your medical conditions. And I would like to stress again, cardiovascular health is very important to improve and maintain for overall well-being. Take charge of your life to get healthy and stay healthy. Here are some helpful links and additional resources. Again, I already highlighted MyPlate. I think that's a great resource for trying to eat healthier, as well as understanding the different nutrition as intake that you do need according to your age, as well as other factors. The American Heart Association is a great resource in understanding cardiovascular disease, as well as your heart in general. A lot of information from the slides I got from Life's Essential 8, which is how to maintain good cardiovascular health. And the CDC is a great resource too for general information about heart disease and how to prevent heart disease. right? And these are my references. Again, a lot of references.
Mm.
But I did do a lot of research in regards to prevention as well as statistics overall. And that is the end of the presentation. So thank you again for everyone on here. And if you have any additional questions, you could always reach out to the Quincy Health Department Nursing Office at this number.
All right, Sandy. I have some questions for you as you were talking and presenting, just things were just kind of like popping up in my head. There was a data actually, if you can go back to your slide 8, the cardiovascular disease by states. It's just so interesting that when you look at that slide and then the one after it with the diabetes by state, it looks like Massachusetts are, like you said, we're holding our own as far as being in the top 20. And it looks like along with the other, some of the New England states as well, like Rhode Island, and I thought I saw Vermont as well. So that's a good thing. Why do you think, as far as the top states, it looks like consistently you have Utah and Colorado being ranked at least top 5? What do you think what are they doing right that we can kind of borrow from so that we can, bump up our statistics in a better way, because we know that Colorado, they get their snow, they have the cold weather as well, right? What are they doing right? What do you think?
So I think I don't know the policies for those states specifically, but if we're really thinking about the environment of those different states and like the weather as well as I guess like the farming that's available there, that could be a really big factor in the fact that they are ranking higher in the cardiovascular disease as well as in the diabetes, is because a lot of it is based off of, again, I think nutrition as well as diet and health. So I think because they're, again, I'm not too familiar about their policies or about their environment itself, but I think, for Utah and California and Colorado, there are areas where it's very, very much so warmer and tends to be baseline warm. There's not really too much snow, at least I would say, in some parts of like Utah as well as Colorado, and for California, so I think a big portion is weather and the fact that people can go outside too. I think for physical activity itself is that in California, I mean, I just went to Los Angeles recently too, and I just saw everybody biking everywhere. I saw everybody just walking everywhere, and the weather was just very nice compared to New England as of right now. So I think because there's always more sun, better weather, that could be a big factor in the fact that they are ranking higher in these with these disease states. Yeah, I think for New England itself, we have such a big change in seasons, and because of that, it's really hard to get your vitamin D from the sun. It's hard to really go outside and motivate yourself to like go running outside, or because we'll have to go to the gym too. For example, like today is snowing, so most likely I'm going to stay indoors because I don't want to go drive in the snow. I don't want to like have to go drive to the gym because of that. Or I could just work out at home, but that also depends on whether or not you have space in your home to work out. Or if you want it, or if you have any videos that you can work out to and things like that. So I'm not too sure about the policies, but I still think for policies, Massachusetts is doing really great with access to food in general, as well as trying to have physical activity, especially for the younger population, as well as the older population. But I think overall, I think a big factor is environment itself and where you are in these states.
Yeah.
So, yeah.
Yeah. I mean, going back to one of your, going back to one of your first few slides, you talked about the social determinants of health and how environment is also a factor. Certainly, that's a big factor here in Massachusetts. Compared to the other states that are ranking high, like Utah and Colorado, look at how small our state is.
Yes.
And, so the other states are more expansive. They have more land and, the weather's better and you don't know what lifestyle is. Is it less stressful? I think one of our viewers here chatted less stressful life. I know
Okay.
we don't know that, maybe.
Mhm.
But there's a lot of different factors, cost of living.
Yeah.
It's just
Mhm.
so, there's a mesh of different factors that has to do with how it's impacting our health, overall health. Yeah. So, going back to the COVID-19 and cardiovascular health slide, I think it's slide 5.
Yes.
Yeah. When we were talking about having you on the program, it was just so talking about, what's going to really be important for people to know. Well, certainly, the impact of one of the biggest pandemic that has hit everybody's lifespan is the COVID pandemic. And, it's so interesting how from the social isolation or social distancing, however you want to phrase it, how it's really impacted a lot of people's health, in particular, the older adults.
Yes.
Yeah. So, cardiovascular disease jumping up so high. Um, it's just, I can't believe it. I had a suspicion it would go up higher because, there's just people are not able to move around more. Their routine has changed. Being outside in the public arena, even like grocery store, had to kind of go down. So people had to kind of do what they thought was the best is, doing a lot of takeout food because a lot of takeout companies, they seem to be thriving during that time.
Oh yeah, definitely. I think I think overall it's because, because COVID hit so hard at the beginning, a lot of people were afraid to go back outside, because again, COVID-19 was such a brand new disease that happened to us that there wasn't a lot of information on what it is, like what are the effects, like, and because we had such a high death rate at the beginning, I think people are just afraid, were afraid to go outside, which is, very normal, obviously, because COVID-19 was very unknown at that point. I think now that we have like vaccinations as well as more research on COVID-19 itself, I think it's great to see that people are trying to change that, because we were in like kind of a lockdown for a good amount of time. And because of that lockdown, people really wasn't able to have those social connections or even just going outside to the grocery store. And we had to be more careful about our actions during that time. But I think overall, I think COVID-19 is still going to stay no matter what right now. It's been 4 years since the pandemic started. I think now that we have vaccines available, as well as different treatment and testing, there are ways to help lower that fear of going outside or that fear of catching COVID-19. But again, I think it's all based off of your own personal viewpoint on that. And if you feel more comfortable wearing a mask going outside, definitely wear a mask if you feel comfortable with that. If not, that's totally fine as well. I think, again, overall, COVID-19 itself really highlighted the social determinants of health and how it affects different populations. But I think overall, because of COVID-19, I think on a state level is that we did try to do our best with handling food access as well as handling overall healthcare access. But it was a pandemic, so it was a tough time, but I think we really got through it. And I think these after effects right now, people are managing in their own ways and doing the best that they could.
Yeah, yeah, yeah. It's just so, yeah, I totally agree. I totally agree. I mean, it seems to be more and more data showing different things that have gotten worse because of the COVID pandemic. Certainly, there were some good things that came out of the COVID pandemic. Becoming more innovative and trying to connect with people that you care about even more, and again in like creative ways. But, when you think of the COVID pandemic itself, it leaves like it can be it's been traumatic for some people.
Oh, definitely. And I
Yeah.
know that traumatic effects, it does last a long time. So
Mhm.
I think as long as you're able to really hone in your social connections, get help if you need help, I think those are the biggest things in
Yep.
regards to um, trying to handle these changes since the pandemic.
Definitely, definitely. Can you go back to the slide with risk factors? I think it's 12.
Yeah.
Yeah. Yeah. So can you talk a little bit more about non-modifiable? Can you explain that a little bit more for some people? And also if you could explain a little bit more the modifiable risk factors.
Yes. So for non-modifiable risk factors, those are the risk factors that you can't technically change, you know. So for example, you can't change your age, you know, like we're all gonna continue aging. The aging process is a normal process in life itself. So age is definitely is a non-modifiable risk factor. Um, I can say either sex or gender for the risk fact for a non-modifiable risk factor. Again, there's nuances to that. But I think overall, I think there are some statistics that men that are over 65 have a higher rate of cardiovascular disease. I know I didn't add that statistic, but I read in the CDC for that. But also I know that there is women within the menopausal age tend to have a higher risk as well for cardiovascular disease. So again, gender itself may or may not be a non-modifiable risk factor, but depending on your age as well as your gender, it could increase your risk for cardiovascular disease.
Mm.
Genetics itself is non-modifiable. You know, we are born with the genes that we have, and you know, you might have your family history might have, um, you know, high blood cholesterol or high blood pressure overall. So again, those are some genetics. Genetics are things that we can't change. That's what we're born with usually.
Mhm.
And again, non-modifiable risk factors include race and ethnicity. Like we said, I think for race and ethnicity statistics, I think it was African American and Black Americans tend to have higher rates of cardiovascular disease in the United States. Again, it's not a non-modifiable risk factor is your race and ethnicity, your background. And in juxtaposition to non-modifiable, we have the modifiable risk factors. And those are things that you can change. They're more like lifestyle, things that you could change, such as your physical activity level, what you eat, your smoking and your drinking habits, as well as because of blood pressure and blood cholesterol, as well as diabetes, as well as managing your sugar levels. That's really based off of, again, a lot of your diet and a lot of your physical activity, as well as your weight. So these are all those risk factors in the blue are all things that we could change based off of our lifestyle and our choices that we make.
Mm. Yeah, definitely. Yeah. And there's different types of diets out there. And sometimes they conflict. So it's always good if you're very confused about your diet, ask your doctor if you could have a dietitian, a nutritionist dietitian consult. So that way you have all these a special team of people who can really, put you in the right direction as far as, what is best for you, what is best for your age, what is best for, what you can afford. Because, we can, sit here and say, oh, you have to eat all these like fruits and vegetables or go organic and all these wonderful things. But if a person cannot afford it, but they can afford a quick, Happy Meal or, all these different things from the fast food, then sometimes they feel like their hands are tied if they can't afford the good things. So being able to find creative solutions, talking with experts, trying to figure out what's the best practice out there might be one of the things that could be a game changer for you who are trying to modify your diet. Mm.
Yes, definitely. I agree with that aspect too. I think too, at a state level, we do have programs such as SNAP and HIP. for people who qualify. And I think those are the biggest factors as well to access to healthy foods is that, like you said, your financial state is a big portion to um, even buying healthy food. Because even right now, vegetables and fruits are very expensive. I'm going to the supermarket and a lot of it is, over $5 sometimes. And I think as long as if you do need any resources, definitely reach out to your healthcare team, reach out to your social network as well, and look at resources that the state might have, or that your local resources might have. I think those are the big things. Is like trying to search for those resources too.
Yeah, that's a very good point. I totally forgot about other resources like the SNAP. Yeah, that's great. Yeah. So who would people contact to learn more about what they are eligible for? Maybe in, their cities and towns that they live in. Would it be their city hall? Would they go right to the mass.gov, the state website? What is the best way?
I think, at least from my experience, it seems like the mass.gov is the first place that you would look. But you could always go into, I know local communities usually have like food pantries, or as well as community action programs. I know like Quincy community action programs, we have QCAP in Quincy. They're able to really help out with finding those resources. Even here at the Quincy Health Department, if you need to find resources specifically for access to food, or finding your eligibility for, health insurance or things like that, we could direct you to resources too. Again, I think Council on Aging is a great resource too for the older population in regards to understanding Medicare, as well as other state programs that might be available for resources for food as well as healthcare. I think so. Like senior centers is a big portion, is a big resource, and I think even calling the city itself would help too, because I believe the city does have an entity that helps with benefits enrollments and things like that. And usually too, if you do have a healthcare team, and you could ask your doctor or the social worker. Sometimes social worker is able to also help get you to the resources that you need.
Oh, very good point. Yeah, thank you so much. Thank you for sharing that. So we're almost at the top of the hour. We have a few more minutes left. What are some key points that you want the public to take away from, your presentation, and also the resources that they can kind of start looking into?
So I think three key points about this presentation I would like you to take away is, again, cardiovascular health is very important to overall good health. And to improve and maintain cardiovascular health is to change up your lifestyle if needed. So if you're already living a healthy lifestyle, eating good fruits and vegetables, getting regular physical activity, that's great. It's great to maintain that. But if you're not, then, think about changing your lifestyle. Think about, eating healthier. Try to add some fruits and vegetables to your plate, or to your daily consumption. Another big key takeaway is definitely talk to your healthcare team. Please definitely go get tested for, your blood pressure. Check your blood pressure daily if you could. I know CVS and like Walgreens used to have like a blood pressure cuff for you to just go in and check as well. If you don't want to go to the doctors, or if you don't want to go to urgent care, things like that. And get your blood test done, check your cholesterol levels, check your sugar levels. And I think, again, the biggest thing too is if you already have high blood pressure or high cholesterol, please work with your healthcare team in order to improve your disease state. I think those are the biggest key takeaways. And the biggest resources, again, is your healthcare team. You can talk to your pharmacist about your medications. You can talk to your healthcare providers. about any other questions you may have in regards to your medications and how it's affecting your lifestyle. And if you have a dietitian, speak to your dietitian about your nutrition, and what recipes would work well for your condition or things like that. And I think a big thing too is, try to make it a team effort. So not only just your healthcare team, but your family and your friends. Try to have them join you in trying to maintain a healthy lifestyle. Like, look to the people that you live with, ask them, oh, let's go grocery shopping today. And how about let's not buy soda today, when we go grocery shopping. Try to have things not in the home, like soda that's one of the big things for myself is I love to drink soda. So I think one of the big things is that I try to have my family members in the home as well, not to drink soda, to overall help all of us improve in our healthy lifestyle. And go to the gym with a friend, work out with a friend, or just if you're working out, stay on a call with a friend while working out, talk about life. I think those are the big things is connectedness in improving a healthy lifestyle.
Wow. Thank you so much for all those information and healthy tips and, suggestions on how people can start, taking better control of the modifiable risk factors that they might have. And Sandy, I really appreciate your time today. I hope to have you back again to talk about another topic. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Aging Strong, which is sponsored by the Quincy Health Department. Thank you so much, everybody. Have a great day. Bye-bye.